Okay, we're moving on to our next sketch examining heart failure therapy. And our main focus this time will be on the angiotensin-converting enzyme inhibitors, or ACE inhibitors, as well as a few other related agents that also affect the renin-angiotensin-aldosterone system. Recall that in our beta blocker symphony sketch, we covered a few cardioselective beta blockers that were especially useful for treatment of chronic heart failure. Not only that, certain beta blockers actually prolong life in patients with heart failure. That's why at the Beta Blocker Symphony, we included the angel harpist on the center stage, a guardian angel for reducing mortality. And on that note, I'd like to welcome you to April Showers Casino, where the weather is always cloudy with a chance of making it rain. In this sketch, our guardian angel, Lady Luck, will be making her return because ACE inhibitors and angiotensin blockers are agents that reduce long-term progression of heart failure and actually prolong life in these patients. These agents work by blocking the production of aldosterone, the mineralocorticoid hormone that plays a central role in sodium and water resorption at the distal nephron and the maintenance of blood pressure. Well, as you'll soon see, a heist is already underway, and each agent in this sketch has a special role to play, blocking the renin-angiotensin-aldosterone system at every step. It's going to take some card counting, a few stacked decks, and of course, you need a man on the inside. But before we get into each drug's action, let's start with a brief overview of the renin-angiotensin-aldosterone system. It all starts with renin, a protease released by the kidneys that sets off this cascade. See the slot machines? The renin cash marquee should remind you of the name renin, of course. But take a closer look and you'll notice we've included our recurring sketchy symbol for renin, the yellow rain jacket and umbrella. Looks strangely familiar, right? In our sympathetic summer camp sketch, this renin rain umbrella was featured in front of the beta 1 cabin. This is because renin release is controlled, in part, by direct sympathetic activation of beta 1 receptors on the juxtaglomerular cells of the nephron. See that winning combination on the closest slot machine? The letters JGA stand for the juxtaglomerular apparatus, the site of synthesis, storage, and release of renin from the kidney cortex. Notice, too, that we've made the marquee above conveniently kidney-shaped. Active renin release is controlled by a variety of factors, including reduced renal arterial pressure, direct sympathetic activation, and reduced renal sodium delivery. So, in low volume and low pressure states, renin is released by the kidney, subsequently cleaving circulating angiotensinogen into angiotensin 1. Think of that circulating precursor, angiotensinogen, as this sad-looking fellow here, circulating from machine to machine, just waiting to get activated and win some big money at the renin slots. What the? It looks like someone's just hit the jackpot. See how he tightens that red necktie as he basks in his not at all skill-based glory? Well, angiotensin 1 will be represented by the single tense red necktie, activated by the renin slot machine. Angiotensin 1 has little biologic activity. Instead, it must be converted to angiotensin 2 by angiotensin-converting enzyme, or ACE. This will be depicted at the poker table in the center, where our nouveau riche angiotensin 1 gentleman spends his winnings. ACE will be represented by the dealer here, laying down an ace of clubs during a high-stakes match at Texas Hold'em. ACE is distributed widely throughout the body, especially in the vascular endothelium of the lungs. So we've made the dealer's vest resemble a pair of lungs. It looks like an ace wasn't quite the card our angiotensin friend was looking for. Over on the right side of the table, we have our winner. And notice that he's pulling tight on those stylish red suspenders as he rakes in the chips. Those 2 tense red suspenders instead of 1 tense red necktie of our loser represents angiotensin 2 converted from angiotensin 1 by ACE. But where will our tight suspended champion spend his winnings? Well, angiotensin 2 plays a key role in the regulation of fluid and electrolyte balance, as well as maintaining arterial blood pressure. And over on the right side of our sketch, we'll depict the important actions of angiotensin 2 at the kidney and adrenal cortex. However, first of all, I want you to keep in mind those tight red suspenders. Angiotensin 2 is a potent pressor agent that acts directly on vascular smooth muscle to cause contraction. So let those tense constricted suspenders remind you of vasoconstriction caused by angiotensin II. This pressor effect is also mediated by angiotensin II's actions on the brain and autonomic nerves, where it potentiates the effects of the sympathetic nervous system. Angiotensin II's action on vascular smooth muscle becomes especially important at the glomerulus, where it plays a crucial role in preserving GFR. Take a look at the coffee station in the back, where our angiotensin Victor has decided to grab a celebratory cup of coffee. As indicated by the gauge, it looks like the ground's filtration rate has been turned up to the max, which depicts angiotensin II's ability to increase GFR. But what's his secret? Well, take a look at the glass of coffee being enjoyed by our suspenders sporting gambler. See how he's pinching the distal end of his bendy straw as he savors every last drop? This represents efferent arteriolar constriction at the glomerulus. As he pinches down on the distal arteriole, imagine blood backing up and increasing pressure at the glomerulus, thus increasing filtration. This is especially important when there isn't enough blood flow to the kidney, which can occur during low volume states or when renal arteries are obstructed by atherosclerosis. See that obviously low volume state of his glass of coffee? When GFR would normally plummet, angiotensin II is able to increase that pressure and preserve GFR. So, now that we've covered pressor effects, let's highlight angiotensin II's role in regulating fluid and electrolyte balance at the nephron. Over at the sports betting booth, it looks like one of our angiotensin friends has decided to put all his winnings on the line. It looks like it's racing today. And spoiler alert, it's a little preview of our sketch involving electrolyte balance at the proximal convoluted tubule, hence the name Pro-Cart Track. See that sodium salt-ridden peanut snack in his hand? It's our recurring sketchy symbol for sodium, highlighting angiotensin II's direct action at the proximal tubule to increase sodium resorption. Angiotensin II also affects sodium retention at the collecting duct, though more indirectly. This will be depicted over at the bar, where our last suspender-clad patron is also enjoying those salty peanuts. So sodium-y. Let the name mineral bar represent mineralocorticoid production. This occurs at the adrenal cortex, where angiotensin II has a direct effect on the release of aldosterone, a mineralocorticoid. Also, whenever we mention mineralocorticoids, we'll include a kind of mineral crystal theme, as depicted in this luxurious crystal chandelier. So, angiotensin II increases the release of aldosterone, a hormone that acts on the nephron collecting duct to increase sodium and fluid retention at the expense of potassium. See those empty glasses and banana peels strewn on the floor? It looks like Alex DeLarge over here has downed a few banana daiquiris, conveniently displaying our recurring sketchy symbol for hypokalemia, some potassium-depleted banana peels. Overall, angiotensin II increases sodium and fluid retention by directly acting at the proximal tubule and indirectly at the collecting duct by increasing aldosterone release. Remember, increased aldosterone means increased potassium wasting. Alright, it's time to reveal some of the agents that treat heart failure and hypertension by interrupting this renin-angiotensin-aldosterone cascade. First, let's examine the role of ACE inhibitors. Recall that ACE is the enzyme depicted at the poker table converting angiotensin I into biologically active angiotensin II. And if you take a look at the playing surface, we've included the name of the casino, April Showers, which highlights the suffix pril, common to all ACE inhibitors, such as captopril, enalapril, lisinopril, and ramipril. Remember that inside agent I mentioned earlier? Yep, you've guessed it. We've got the dealer in on our little scheme to take the house's money. And because we're talking ACE inhibitors here, we've made her pocketing that ace. By preventing conversion of angiotensin I into angiotensin II, ACE inhibitors counteract those usual pressor effects. Aw, and look at our poor angiotensin loser, looking pretty deflated. ACE inhibitors decrease systemic vascular resistance and promote natriuresis. In other words, ACE inhibitors reverse all the effects of angiotensin II we highlighted at the right side of the sketch. For example, instead of preserving GFR by constricting that efferent arteriole, ACE inhibitors cause dilation of the efferent arteriole, reducing glomerular pressure and decreasing GFR. In fact, it is expected for the GFR to decrease in all patients initially, resulting in a bump of creatinine by as much as 30%. Next to our depressed angiotensin friend, who immediately regrets following George Clooney's advice to bet big and take the house, let's sketch in his credit card, which he hopes has a high enough limit as he racks up his debts. Think creatinine credit card. And let it remind you of the bump in creatinine that is common within the first few days of starting an ACE inhibitor, just like the foreseeable bump on this guy's credit card bill next month. He looks pretty depressed though. I mean, look at him. I think he's unconscious. When initiating ACE inhibitor therapy, watch out for significant hypotension in patients who already have high renin levels, such as those with heart failure. In these patients, the abrupt removal of the vasoconstrictive effects of angiotensin II results in a precipitous loss of blood pressure and can lead to syncope. To prevent this, medication can be started at a low dose and slowly titrated. Remember that ACE inhibitors reduce pressures not only by counteracting angiotensin II's direct pressor effects, but also by promoting natriuresis. Keep that pro-cart track and mineral bar in mind, because these agents prevent angiotensin from retaining all that sodium at the proximal and distal tubules. By decreasing aldosterone secretion, ACE inhibitors increase sodium excretion and potassium retention. This effect is responsible for the hyperkalemia seen in patients taking ACE inhibitors. See our Victor here as he toasts Lady Luck with his banana daiquiri? A raised banana is our recurring sketchy symbol for hyperkalemia, and you'll see it a few more times in this sketch. Each agent we cover will block the renin-angiotensin-aldosterone system in some way, all leading to decreased aldosterone activity, thus sparing potassium. We've made our angiotensin I winner standing, as well as a little reminder to keep negative feedback loops in mind. If angiotensin II is depressed, blood levels of each preceding molecule will increase, including angiotensin I and renin. Just remember that when you block a step, everything before it will increase. ACE inhibitors are versatile drugs that have many clinical uses. By reducing peripheral resistance, they reduce afterload, so the heart doesn't have to push so much. By reducing salt and water retention, they reduce preload, so the heart doesn't have to carry so much. Also, with less angiotensin II floating around, sympathetic activity on the heart is reduced. All these effects make ACE inhibitors one of the first-line agents for chronic heart failure. See that floppy, failing heart balloon in the back? It's our recurring symbol for heart failure, and possibly an iconic symbol of the long-term outlook for these two eloped lovebirds. See that angel up there at the peak of the chapel? It's our guardian angel, protecting us from mortality, here to remind us that ACE inhibitors actually reduce mortality in patients with heart failure, just like certain cardioselective beta blockers. This is likely due to their ability to decrease chronic angiotensin II-mediated left ventricular hypertrophy and remodeling, which diminishes contractile function. So, just like in our beta blocker symphony sketch, we've got some remodeling going on in the back. In fact, ACE inhibitors are thought to play a critical role in attenuating the cardiac remodeling that follows myocardial infarction as well. Whenever we want to convey heart attack, we'll bring back the recurring symbol evoking some broken heartstrings. This time, incorporated into the guitar of our supportive best man. The initiation of ACE inhibitor therapy is part of the standard ACS protocol for acute myocardial infarction. And remember the guardian angel. The addition of an ACE inhibitor has been shown to improve survival in patients with recent MI. Because of their ability to lower peripheral vascular resistance, ACE inhibitors are also one of the first-line agents used to treat primary hypertension. So let's sketch in our recurring hypertension symbol, some high-pressure pipes ready to burst. Why in a candy shop, you ask? Well, we always include a sweet hyperglycemic candy jar whenever we want to convey diabetes. And at this Dia-Sweets candy shop, I want to emphasize that ACE inhibitors can be especially useful for treating hypertension in diabetic patients. Because, as it turns out, these agents can also slow the progression of diabetic nephropathy. And that's why we've included these sugar-loaded sclerosed kidney lollipops. Diabetic nephropathy, classically defined by the presence of proteinuria, is a common problem that is most likely to occur in patients who have worse glycemic control or concomitant hypertension. The earliest clinical manifestation of renal involvement in diabetes is an increase in albumin excretion, which may be a sign of glomerulosclerosis. On the exam, a question may involve a diabetic patient who arrives at your office. His glycemic control a little less than adequate recently, and you measure a few elevated pressures as well. How should you treat that hypertension? Well, a little farther down in the prompt, you're also given an important lab value: increased urinary albumin excretion. See this little candy album here showing off their extensive and diabetes-inducing selection? An album is our recurring sketchy symbol for albumin. Patients with persistent, moderately increased albuminuria and blood pressures greater than 130/80 are usually started on an ACE inhibitor. In fact, even in the absence of hypertension, diabetic patients with proteinuria are often recommended to start an ACE inhibitor to reduce the risk of renal disease progression. So look for that increased albumin excretion on the exam. Keep in mind that these early signs of nephropathy cannot be detected on dipstick. Moderate albuminuria, defined as 30 to 300 milligrams per day, can only be detected by urinalysis. All right, it's that time to discuss side effects. There's always a question about those classic ACE inhibitor side effects. Back over at the poker table, where our robbery is underway, our ACE pocketing dealer is giving the signal. Signal. A dry, non-productive, and persistent cough is one of the most well-known side effects of ACE inhibitor therapy. The mechanism of this induced cough is believed to involve bradykinin, substance P, or prostaglandins. This is because ACE is a non-specific enzyme that actually breaks down many substrates. Thus, ACE inhibition leads to increased levels of substance P and bradykinin. Let these red inflamed braids remind you of increased levels of bradykinins, specifically that can cause inflammation and stimulate lung irritation. This is especially important to keep in mind in patients with hereditary angioedema, an autosomal dominant condition that causes episodes of painless, non-pitting edema. ACE inhibitors may precipitate these episodes and are therefore contraindicated in these patients. This will be represented by the woman in the back getting politely escorted out of the building because she was caught cheating. Don't worry, she's not part of our team anymore. Anyway, she's going to represent situations when ACE inhibitor administration is contraindicated. First, notice that we've given her a prominent lower lip with a cool lip ring. This is because angioedema commonly manifests on the face, lips, and tongue, and her C-shaped lip ring is supposed to remind you of C1 esterase, an enzyme that normally activates the complement pathway. Patients with hereditary angioedema have deficient C1 inhibition, which leads to increased complement products and bradykinins, leading to excessive vasodilation. We've made her pregnant because ACE inhibitors are also contraindicated in pregnancy due to the risk of fetal hypotension, anuria, and renal failure. This is also depicted by her intimidating leather jacket, emblazoned with our recurring teratogenic tarantula. Let's sketch in a fire extinguisher next to the exit, because I also want to highlight an important interaction between ACE inhibitors and NSAIDs. A fire extinguisher is our recurring sketchy symbol for NSAIDs, kind of like inflammation extinguishers. NSAIDs decrease prostaglandins, which are normally responsible for dilation of the afferent arteriole to preserve blood flow and GFR. NSAIDs therefore lead to a constriction of the afferent arteriole and decreased GFR. Think of that red glomerulus knot as getting decreased flow because the fire extinguisher has that proximal afferent constriction where it's clamped. Well, if you recall, ACE inhibitors also decrease GFR by counteracting angiotensin II-mediated efferent constriction. When given together, these two agents can precipitate acute kidney injury, as depicted by the cracked kidney-shaped glass. ACE inhibitors can also precipitate acute renal failure in patients with bilateral renal artery stenosis. See this couple of renally shaped purses filled with her illegal winnings? The security guard grabs both straps just like bilateral renal arteries being stenosed. On the exam, these patients will present with long-standing hypertension, But then they'll slip in something like a history of angina or a TIAS or coronary artery disease. Well, this patient definitely has got some renovascular disease as well. These patients are reliant on that angiotensin II vasoconstriction to preserve GFR. Once you add an ACE inhibitor, renal blood flow falls and acute renal failure may develop. This will be seen as a significant increase in serum creatinine, more severe than the normal predictable rise in creatinine that we had highlighted earlier with the creatinine credit card. I mean, just take a look at that creatinine credit card bill. Ooh. Persistent creatinine levels over 30% of baseline may indicate renal insufficiency and require discontinuation of therapy. All right, before we wrap up this caper, I want to remind you that we've got other agents here, inhibiting this renin-angiotensin-aldosterone cascade at every turn. One way is through direct angiotensin receptor inhibition. Angiotensin receptor blockers, or ARBs, are competitive antagonists of the AT1 receptor, thus blocking all of those angiotensin effects depicted in the right side of the sketch. At the proximal convoluted tubule bedding booth, for example, ARBs compete with angiotensin for receptors, just like this seat being saved for one of our agents now. Let the sorry taken sign remind you of that sartan suffix common to all angiotensin receptor blockers, such as losartan, valsartan, and candesartan. ARBs have similar effects to ACE inhibitors, so they can be effective in many of the same clinical scenarios, including heart failure, hypertension, and diabetic nephropathy. This is especially important when a patient is intolerant to ACE inhibitors because of persistent cough, for example. ARBs do not inhibit ACE and therefore do not cause the same increase in bradykinins. As with ACE inhibitors, however, watch out for that hyperkalemia due to aldosterone inhibition, which is why this seat is being saved with one of those potassium-enhancing banana daiquiris. Our other agent is a direct renin inhibitor. And over at the renin cash slots, it looks like one gambler is still hoping for a little precipitation. Notice that the words high-risk slots kind of slant rhymes, maybe, with Aliskiren, a direct renin inhibitor that prevents conversion of angiotensinogen to angiotensin I. It can be used in the treatment of hypertension, and it has a few similar side effects to ACE inhibitors, including hypotension, decreased renal function, and of course, because of decreased aldosterone, hyperkalemia. 3 bananas. Let's see. Nope. Not a winner. All right, you know how luck has a very unladylike way of running out. So let's cash in our chips and sum up this sketch. Angiotensin converting enzyme, or ACE, is responsible for converting angiotensin I to angiotensin II. Just think of that ACE face up on the poker table, compelling our patron wearing the single red necktie to transfer his chips over to our winner, wearing the doubly tense red suspenders. Angiotensin II plays a key role in the maintenance of blood pressure, as well as the regulation of fluid and electrolyte balance, and these effects are all outlined at the right side of the sketch. So because our ACE inhibitors prevent conversion of angiotensin I into biologically active angiotensin II, they reverse all these effects. In other words, they prevent angiotensin II-mediated efferent arterial constriction, thus decreasing GFR, which can cause a bump in serum creatinine in many patients. Remember that creatinine credit card. Also, ACE inhibitors prevent angiotensin II's direct vasoconstrictive effects, as depicted by our deflated angiotensin II loser. When thinking about fluid and electrolyte balance, remember that ACE inhibition prevents angiotensin II-mediated sodium retention at the nephron, leading to natriuresis and fluid loss. And because this also means decreasing the production of aldosterone, we are preserving potassium here, hence the banana daiquiri toast to Lady Luck. ACE inhibitors are important in the management of acute MI and heart failure and actually provide survival benefit in these patients, as our guardian angel suggests. Also, ACE inhibitors are one of the first-line drugs for treating hypertension. This can be especially useful in diabetes because these agents can slow the progression of diabetic nephropathy. Just remember those sugar-loaded sclerosed kidney lollipops. All right, don't forget that classic ACE inhibitor side effect, the old captopril cough, caused by increased bradykinins, represented by our red inflamed braids. This is especially important in patients with hereditary angioedema because of a C1 esterase deficiency, when ACE inhibitors can precipitate acute episodes of face, lip, and tongue edema. Just look at that prominent C-shaped lip ring on the woman getting thrown out. Remember too that she sports the teratogenic tarantula leather jacket to remind you that ACE inhibitors are not safe in pregnancy. Our NSAID fire extinguisher should warn you that if you combine NSAIDs and ACE inhibitors, watch out for decreased GFR and increased risk of AKI. Also, our security guard holds on to our last contraindication, bilateral renal artery stenosis, when angiotensin is vitally preserving that GFR. Give an ACE inhibitor and bam, huge increase in creatinine like that huge credit card bill. Getting a cough with an ACE inhibitor? Give a sartan angiotensin blocker instead. Sorry, angiotensin, this seat is taken. Or maybe you feel like directly blocking renin. Say hello to the high-risk Aliskiren slots. Either way, I see hyperkalemia in your future. Okay, where we're going next is a little more family-friendly. Yes, but that doesn't mean we're done with heart failure. Not only are diuretics the first-line agents for symptomatic treatment of heart failure, but some of them actually make patients live longer. So put down that banana daiquiri, take off those ridiculous suspenders, and get excited for some diuresis at the Nephron Fun Zone and Water Park.